The World Health Organization says non-communicable diseases account for approximately 45% of all deaths in Ghana, with cardiovascular diseases making up 19% and cancers 5%. Also, patients suffering from some non-communicable diseases require up to 50,000 cedis for treatment every year. To provide support for their treatment and reduce the burden and spread of NCDs in the country, President John Mahama has launched the Ghana Medical Trust Fund, known as Mahama Cares, at the University of Ghana Medical Center. The fund will require 3 billion Ghana cedi within the next 3 years, with funding support from the NHIS, budgetary allocations, and corporate sponsors.
Initial projections suggest the fund will require approximately 3 billion Ghana cedis annually over the first 3 years. And as was said, the main source of finance is going to come from the NHIL, the uncapped portion of the NHIL. It will also include direct budgetary support from government, voluntary contributions from corporate institutions and individuals, grants, donations.
Setting the tone for donations, President John Mahama has pledged to donate 6 months of his salaries to the fund once he begins to receive pay.
I've pledged half a year, 6 months of my salary to Mahama Cares. I'm not yet being paid. They say Accountant General is still doing something. But whenever Accountant General finishes, 6 months of whatever I'm entitled to will go into Mahama Cares.
He also called for stronger public awareness on lifestyle-related diseases to address the rising cases of NCDs.
A lot of these diseases are caused by ignorance in terms of our lifestyles and all that. And so we must also, as part of the Ghana Medical Trust Fund program, launch a very strong awareness campaign so that people will know what the trigger factors for these non-communicable diseases are. I understand that some of them are genetic because you can inherit it from your parents in your genes, but a far greater number are lifestyle diseases, they are acquired.
For legal backing, Health Minister Kwabena Minta Kando has assured that a bill will be presented to Parliament for approval once the House resumes.
The task force inaugurated to guide this process has successfully completed a comprehensive policy document detailing the operational and management framework of the fund. Secondly, the draft bill for the establishment of the Mahama Care Fund is now ready and will be submitted to Parliament immediately after the recess.
Some of the NCDs the fund will cater for include cancer, diabetes, cardiovascular diseases, chronic kidney failure, stroke, and other major complications. Collins Frimpon's report for Joy News.